probably review with you next, hopefully a week from Wednesday there'll be no class. Okay. We're doing our practice on what you want, we're doing it. We start 8, 9, 10, 11, like 9, 10, 11, 12, and we might have to do 1, 2, 3. We'll do that. Somebody just get that. This way here, you're done with totally next Wednesday. And I'll see you again. This way it gives you all that time to study for your written final. Don't have to worry about the project Thursday or Friday. Okay? We'll go that and lack Thursday and Friday this way you can decide. We all should be there every Wednesday morning because we have class on Wednesday. So Monday would be finish the course. The review sheets, I'll try to get them out to you by Wednesday. Your last test. Review will be out next Monday with you after finishing up the nervous system. Endocrine won't be out. Russian nerves. Mesenteric also is. Sure. No, we're doing one now because it's supposed to be an AP2, we're doing it here. Which makes sense not to. Why wouldn't you do it here with your nervous system?
Yeah.
So when you walk in, you have an idea of what's going on. Instead of being like lost in the way of the bars. Take one of these. When I walked in this morning, I heard people pile like, okay, the guys are doing the surprise test. We're going to see her study over break. They almost had a heart attack. It's fun playing games like that. It really is. So it's just you now. Started off with the 3 months. Well, the other friend's still around, but she's just making all that money working. This makes it easier to do your notes. If you don't want to write it out today, fine. But when you put, it's a study guide. Notes and study guide all in one from this point to the end. That's why I do this for you. The fast, easy way to bring everything in your head. And the first best way to learn these things is number and name. Don't worry about what it does in the beginning. Get the number and name down in order. Why don't you take it? Because you can't read people. Anybody else put their case study thing? Of course, that tryptophan makes you tired. It has something to do with the bottle of wine. You did?
No, I need.
Oh, you need more than a bottle of wine? Possibly make a move with that. She needs more than a bottle of wine. Yeah, the PowerPoint thing's not working. We're going to do a fast way to prove it. Beautiful academic computers. So, let's show you this one other picture. That's the iron lung. So, now you have respirators and stuff. But that was put on polio victims. It was a chamber that was pressure tight when the person was put in it. And this way their chest would go up and down so they could breathe. So there was a thing in there, a machine that like a compressor would go up and down on the chest so they would breathe. Without it, they would die. Because it damaged the anterior horn cells, which control respiration. So they lost that. So people that were really severe ended up in this. Some people ended up in this until they died. You know, one wonderful way to stay like that. Really? That's not life. And then look at the mirror and see what was going on. People talk. This was a scary thing. As a child when this stuff was happening. Like 5, 6 years old. Young, but still. You remember it, and then the vaccine came out. I remember you didn't have lines that you go to clinics and get it. Put it on the sugar cube and stuff. So that was like another thing. I was reading a good article this morning, and it was on the big statin funds, statin drugs. The main thing they do is destroy the liver from producing hormones it has to produce, and muscles. So they get pain. Causes muscle wasting, which then causes kidney damage. So they do a lot of good. And the studies show that there's no study ever done showing it prevents heart disease or stroke. Then there's another study done that people with lower cholesterol have a 40% higher risk of suffering a heart attack or stroke. So they're higher cholesterol. Because it's a hormone now that the body needs to produce other hormones. So just keep that in the back of your head as you get brainwashed by the pharmaceutical industry someday. So the first cranial nerve is the olfactory, number one. Number one, olfactory. Olfactory means sense of smell. So being it's a sense of smell, what type of fiber do you think I am? Sensory, motor, or both? What do you think? It's a sensory, exactly, it's just sensory. So if you look at things as type fiber, you write sensory. What does it innervate? Olfactory epithelium. That's in the nasal area. So your area of innervation would be olfactory epithelium. To add one more column, you'd say, what it passes through. Well, how do you get there? It goes through the cribriform plate of the ethmoid to get there. So it's pretty straightforward. So when you look at this, the schematic is so much better than the words. And the nausea means you can't smell something. There it is. It just describes it to a T, what's happening. Optic, olfactory nerve, bulb, cribriform plate, innervating the top portion of the nasal cavity, which is where your epithelium is for olfaction. I got sensory because I'm just smelling. First one's easy. See how much fun and easy that is? What the heck? 14 people. 48 the first day, now 14. I'm sure there's about 10 more, but still. Here we go, see? Are you still Christmas shopping? Better get a good gift from the professor, so I'm telling you. Okay, so we go with this one. Again, number one, olfactory, sense of smell, so just sensory fibers. How did it get there through cribriform plate? What's it innervating? Olfactory epithelium, olfactory mucosa. Okay? Good with that? You're going to get hit heavy with this cranial nerve on the last test. So just know them. Know that. Know if something's wrong, what would happen? I can't smell. This is the nerve that's damaged. Okay? That's the stupid thing to do real fast. Number two, optic. So I'm not going to stay. I'm going to go right to the picture of the brain. This picture will be on your test because there's going to be questions that relate to it. But if you know it, you don't really need the picture to answer the questions. So again, optic means what? Vision, right? Sense of vision. So what fiber do you think it is? Sensory or motor? Sensory. Okay, well that's easy. Yes, it is easy. Sensory. What did the nerve go through to get there? Remember that? What was in the skull that you learned that has this name, optic canal, so it goes to the optic canal. And what's its area of innervation? The retina. Or retina, depending how you want to pronounce it. The retina. So that's not confusing, I hope. Confused with that? The ego confused? Okay, maybe. Did you buy the house yet, Mr. Ivy?
We moved on Friday.
Oh, Friday. You're not missing much. You're missing like a waste of 20 minutes.
The schedule was closing at 10.
You're not missing much. Don't worry about it. You just have to figure out what time is good for you for the test. On Wednesday, let me know when you come in here, okay? All right, so now here's the prompt that it gets tricky. Because look at this red and this green here, right? The crystals, red and green. The visual cortex in the back of your head. It's going to smack your head, you should have, that's where it is, posterior lobe. But occipital lobe rather. So look here, and Some cross, some don't. You guys have to take your earlier courses.
I drove.
Oh my
It's
God.
not that nice outside.
Oh,
Like,
please,
I'm
please. Oh, come on. You live 5 minutes away. Yeah. Tell it to the judge. Okay, back to number 2. So we went through the easy stuff. Now here's other questions we're going to ask. If, I'm going to say there's the right, this is the left, that's the right, okay? If I was to cut the right optic nerve, what would happen to the right eye? Well, if I unplug the computer from the wall, what happens to it? It shuts off, right? So if I cut right through a nerve, you're blind. Does that make sense? All right, so if we cut here, the right optic nerve, or the left, the eye, anything distal to it doesn't work. That makes sense, right? Don't be so lively. Okay. The next one is, I make a sagittal cut to the chiasma. Because this is the tract, that's the chiasma, that's the nerve. Boom, right through it. I would lose medial vision in both eyes. Just follow the green and red wire. Where they're going? To the medial eye. So medial vision in both eyes. So that's pretty easy, right? Yes. Don't get that excited. She throws her phone at me. Well, let's break up the monotony. What are you guys doing? Unpacking forever? You don't need, just follow along with this. You don't need this. That's what you need right now. Just follow me with that. And just write on that, and you'll be good. Then you can look at your PowerPoint later. You have these, so don't worry. Okay. So that's number 2. Number 3 scenario. What, you have a question? I didn't do number 3 yet.
No,
All right.
the first one, so,
Ever since she had her tonsils removed, she got me.
so the second one you just said, if
It's
you got
like
sagittal, you
sagittal
use medial
In both
in
eyes.
both eyes. What was the first one you said?
If I cut the nerve, either right or left nerve, the eye's blind on the side of the nerve. That makes sense, right?
Yeah.
Okay. Oh my God.
Listen,
Oh my
my
God.
tires changed this morning and everything.
Here, take this. You're gonna need this. It's not an aspirin either. This thing. I'm gonna wait a minute for this because you're gonna get too confused. I could hear letter. If I cut the chiasma, no, not a corona. If I cut corona, we're blind. You're severing everything. Think about all 4 being cut. Now remember, back in the beginning, we talked about terms. Ipsilateral, contralateral. Ips meant same side, contra, opposite side. Remember? No, but remember. Here's what I said. The course in itself is cumulative because the shit we talk about started in the beginning, but you just refuse to listen to it. Just refuse. Don't say pick on her. Okay. So, let's bother this side, the room a little bit, because you guys look lonely. So, if we come here, if I was to cut the track, so let's say I cut, this is my right, this is my, I got the right optic track. What would be my vision list? Follow the green. It's on the side of the cut, contra on the opposite, right? So in other words, if I cut the right track, lateral, I would lose lateral vision in the right eye, medial vision in the left eye. You understand that? Yes?
One more time. Yeah, one more
How
time.
come they did and you won't? What's that? Am I speaking a different language to you? Ever since you took the tonsil out, you don't hear good anymore. They must have bothered your ears. Okay.
Okay, so.
All right. I'm going to do it. I'm going to cut here. Follow the green line. What would I lose? Inside or outside? Outside. So that's lateral. Follow this green line. Inside or outside? Inside. The easiest way to learn this is get 4 wires. 2 white, 2 black, 2 red, 2 green. Lay them out just like that. Just remove the wire. You know what happened? that the wire is not hooked to anymore doesn't work. You follow what I'm saying? You understand? Yeah. And like, so on your test, this picture will be here with the lesions. There'll be questions that will be before. You don't label there, just if you get stuck, you go back and look at the picture to see where it's cutting. So you'll have that ability on the test. If you really know it, then you don't need it, but if you don't, the only one you gotta kind of think about is this last one. When you cut a nerve, nothing works. Anything distal to a nerve don't work, so that's easy. Cut the right nerve, right eye, left nerve, left eye. Okay, simple. Sagittal cut to the chiasma, medial vision, both eyes. That's a given. Just look what it's doing. It's slicing out the tracts that are controlling the inside of both eyes. It's when you get to the tract itself, here. So one side of it goes ibs, one side goes contra. So if I cut this one, it would be the opposite of what that one did. I would lose lateral vision in the left eye, medial vision in the right eye. Okay? So it's just following the wire. Let everybody quit. Like they should be leaving. Are they still away for Thanksgiving? I don't know. I couldn't either because I couldn't shoe on. I wasn't hurt too much. But just drink. Yes.
Okay, so just recap. First scenario was the sagittal cut. Second scenario.
No, first scenario was the nerve.
Oh.
Second scenario was the sagittal cut. Third scenario is the track.
But I thought sagittal was the meat where you lose eyesight.
And both, yes.
So that was that.
That was
and
the
the nerve cut you lose.
vision,
sight
and
in
right,
the other.
one or the other, depending on what nerve you cut. The track is going to affect both eyes, one on the outside, one on the inside. Understand?
Yes, I got it.
All right. So if you really get stuck, just get 4 wires and lay them down and just lift them. If I cut this, if I cut this, if I cut that, and you're done. So it's not hard. Once you understand the concept, it's easy. So those who took summer class, we're going to go into this detail at another time, but we need a regular semester, we have time. And I want you to be chilly. You have it. You know what I'm saying. Maybe stare at me like I'm doing something wrong. Just do innocent look in your face. Do innocent look and say, make people feel guilty that they did nothing. They looked what they did. Now we go to number 3. So those first 2 nerves were just sensory fibers, okay? So number 3 now, look at its name, oculomotor. So what do you think the fiber is going to be?
Motor.
Motor. There you go. So your fiber would be motor. Good. And this is the first of the parasympathetic. There's going to be 4 of them. So what I would do is outside of number 3, put a little P next to it, and then make a footnote at the bottom. P equals parasympathetic. So that means this nerve is going to have autonomic function. So keep that in the back of your little minds. Because they're still growing. All right, so here we go, oculomotor. So it's going to innervate 4 muscles that move you around. 4. And here they are listed for you. So it's going to be the 3 rectuses, superior, inferior, medial rectus, and the inferior oblique. So when you say, okay, look up, look down, look into your nose, you're testing this nerve. So that's its basic motor function. So then someone's going to say, well, Professor, what's its parasympathetic function? Anybody going to ask?
What's its parasympathetic?
Well, I'll tell you what it is. Good question. The parasympathetic function is the pupil and the lens. Because that's all smooth muscles. Pupil and lens. So when I shine the pen light in your eye, it constricts because of this nerve. So let's look at the schematic, which makes it a little easier. there's your muscles. Medial, superior, inferior, inferior rectus. And there it is coming from the superior roof fissure. That's when it travels through the head there. We're going to find if there's anything under the optic which innervate around the eye has to go through the superior roof fissure or can't get there. And it's going to innervate the lens and the pupil. Okay, so now we bring another question up, the blind question. You already know the answer to this because we talked about it in the lab 2 weeks ago when we were doing the pen light. So, we shine the pen light. We shine the pen light, the person's blind in her right eye. I shine the pen light in her left eye. Of course, the left eye shouldn't react. Will the right eye react? Yes, and that reflex is known as the accommodation reflex. So remember that. Some of the stuff we do in lab, remember, because I'm going to ask you in here. We're going to go over them again when we're doing these nerves. So the accommodation reflex, meaning that the motor function is still there even though there's no sensory function. Now, we shine the pen light in her blind eye. Will anything happen? No. Because there's no sensory response to turn on the motor response. Understand? There's no switch. You broke it. So if you're blind in the right eye and I shine it in the right eye, nothing happens. Because I was cutting the nerve, remember? So if I have no sensory going into my brain, I can't trigger the motor side. But if I shine it in the good eye, both eyes are going to react. That's what that means. Okay? Everybody got that? You got it? You got it? Good. I want you to listen on the last test. And I ask about right, right, right. Once we pick up, right. Correct. Okay. So we all good? We all understand? Yes.
What's the area?
If it's not her, it's her. It's like you guys should be twins.
What's the area of innervation?
That's a damn. Well, when I
Is
mentioned,
that
remember I
the pupil and
the pupil and the lens and the four muscles. Okay. Yeah. In other words, if it touches a muscle, that's innervation. If it touches the lens, that's innervation. Okay. So what do you think? Okay, then that one's easy. Fool. Trochlea. So let's just go right to here. Trochlea. Nice and easy. It's just it's only going to control movement of the eye. So what would its sensory what would the fibers be? Sensory or motor? Motor. Or motor. Depending on where you're from. Motor. Okay. Enough of knowing about motor. All right. There you go. So it comes again to superior fissure. It's going to one muscle only. Superior. So what's its innervation? Superior oblique. Why do we call it the trochlea? Because you see over here, there's this little ligament structure called the trochlea that supports the muscle. Hence, they call it the trochlear nerve. Simple as that. So that takes care of 5 muscles of the eye. So we one left. So, but now I want to go to number 5. I want to jump ship to 6. I want to come back to 5. Okay? I'm going to jump to number 6 on purpose to make it easy. Abducens. Abducens, again, fiber is just motor because it's innervating one muscle, the lateral rectus. We're going to go back to 5. Don't have a heart attack. Lateral rectus. There's no such thing as external rectus. Let me get the word wrong. Lateral rectus.
It says external rectus.
It's wrong on that printer.
I'm gonna say it.
Because you say that in a neurology room, they'll throw you right out. So don't open your mouth when you're in the on the neuro wing.
All right,
The
so
muscle's name is lateral rectus. Go look it up in your book, lateral rectus. Not external. No such thing as an external rectus. We're going to say the other one, internal rectus. It doesn't fit the picture of movement. So the lateral rectus is going to move the eye laterally, okay? So that's the job of that. So in other words, you tell someone follow out to this way, that's what you're testing. You're testing 6. So when you're going back and forth like this, you're testing 3 and 6 at one time. You move it up and down again, 3. Moving at an oblique angle, 3 and 4. Okay? So that's when you test it. The lateral rectus muscle. So it's easy. So you realize how many nerves control the eye? 2, 3, 4, 6. Those all controlling your eye. So you know the nerves when you can repeat them off the top of your head just like that. And you have to learn them as Roman numeral people. Or you'd be surprised if you don't. Because the day of the test, they'll be like, what does that mean? X. No, go to X. Add an X. 10? That's it, you build it. 10. If I put the line before, you go down one. I put the line after, you go up one. That's what it means. How many can dial that out for you? Never used it? Oh, you're kind of young, especially. Huh? Oh, there you go. All the way through. You really got pissed when you misdial something. It takes forever to dial the 7 numbers. Like, just saying. Well, clocks years ago had Roman numeral on them. When we were in school, probably not you, but we had to learn up 1 to 100, and then 500 to 1,000. No, I had to in Catholic school because it was Roman Catholic and Roman numeral. Well, the nuns spent more time beating me up than teaching me anything. So just to beat the crap out of you. That's why you wore a tie, so you can drag you right out of your desk. Pull you right over it. Watch it pull you over it. Oh well. And then you get another beating at home for being bad in school. Yeah. There you go. Just beat up all the time. This is a punching bag. Okay. Whatever. So now we go to 5. Because 5 is a little more difficult. 5 is the trigeminal. This has both fibers, sensory and motor. It has both of them. It's the first one with both. Because the other ones either had just motor or sensory. This has both. The main thing of this nerve, sensation to your face. I slap you in the face. Ow, that's the nerve. You tickle your face. Ooh, okay, that's the nerve. Got it? Sensation to the face. So that's its major innovation. Sensation to your face. The pain, the light touch. Yay. It breaks into 3 divisions. Because it likes to. One does the forehead, the cheek, and the jaw. So the forehead one would be ophthalmic division, or the V1. And that travels through superorbital fissure, and then supraorbital foramen. So it comes out over here. So you do like this, oh, I feel that, good. That's the nerve. Then we go to the cheek area, maxillary, right? It goes to your friend, the rotundum, infraorbital foramen right here, innervating all this, plus the top of your jaw for your teeth and stuff. The last one, mandibular division, again goes through, notice I'm just dropping down, following the foramen out of the skull, foraminal valley, because that was next after rotundum, right? And then it goes to mandibular or mental. If I'm coming outside, the mental going inside, mandibular. Okay. Also, it goes to your tongue for pain. If you bite your tongue, the proprioception of the tongue, this is the nerve that does it. 5. Then you may ask, well, what's the motor function? Well, the motor function is muscles of mastication. Muscles of masticate, okay? Straight, mastication. What's masticate? Chew. Right. It's not the other word, chew, okay? Be nice. All right. So what are the muscles of mastication? The temporalis, the medial-lateral pterygoids, the maxilla, and the anterior digastric. We're going to see the posterior digastric is innervated by 7. The anterior is 5. So again, general sensation to the whole face. That's a sensory innervation. Motor innervation, muscles of mastication. And those muscles' names. Okay? That's why if you grind your teeth a lot, you get temporary. Because that muscles in spasm, pain in here, temporalis. Pterygoids are the wonderful ones for giving you TMJ problems. Because they're the ones that deviate from side to side. Got it? They're right there. This is right here. Got it? Good. You have these too. Everybody got that? You're too quiet today, Richard. I know. She does well, so can't pick on her. Oh, you two became like twins with questions lately. Right here. In the beginning, never said anything. Now, you gotta put a gag on and shut them up. Lots of questions, which is good. One of the grades go up with it is good. Yes, I know it's boring, but we can do it. This is right. So we got that one. So now that we did that one, now we go to facial, number 7. So 5 and 7 go together. Because 7 is the motor to your face. Smile, frown, puffy cheeks, close your eyes. That's 7. And what happens with 7 when you have a condition, it's called Bell's palsy. Did anybody ever hear of Bell's palsy? See what happens? You bang the head against a bell, and you go, no.
It's definitely not the palsy, is it? Because of them.
So it can be caused usually by virus. It can be caused by Lyme disease, Apsiolis, just to give you hints. You know, different bacterial infections can do it. But mainly it's a virus. And what will happen, the person's face will just start drooping as if they're having a stroke. They can't close the eye on this side. So it's like, oh damn. But the difference with this one, even though it's, you know, the facial, so we know it has both fibers. It does have sensory motor. Plus, it's the second parasympathetic one. Ooh. I didn't like that. Yes. So let's look at the schematic makes it a lot easier. The schematic, you don't have to run all the divisions, don't worry about it, the 5 branches. So, what? What'd you say? Because they deserve it. So you don't smack them when they're bad? Well, no, they beat you up, so you can't.
Now they put equal size, but yeah.
I haven't done anything yet. Why you got your hand
But
up?
I didn't get to write down the last part.
What was the last part?
Like, it enters through the internal acoustic.
What? Oh, no, you don't have to worry about where this one goes. This is the only one I don't make you learn because it's kind of difficult. So don't worry about how it gets there. So main thing to know, general innervation motor to the face, okay? So if I make you sneeze, well, this is a nerve. Because 5 and 7 is stenatory. I pluck your hair in the nose. Ow, shoo. There you go. All right? Hit you in the head like this, glabella smells. That's this. Okay. So, now, you're saying, okay, well, what is this sensory? Because I know you people feel like that. What is it sensory? Anterior 2/3 of tongue for taste. Anterior 2/3 of your tongue for taste. That's a sensory. And one other motor one they don't put on here and tell you, the posterior digastric is innervated by this. Anterior is 5, 7 is the posterior. Anterior is 5, 7 does the posterior digastric. Okay, so now we did that, we're in good shape. No, posterior digastric. Is it? What? Why are you making that face like you're ready to have a nervous breakdown?
No. I already read the chapter.
All right, so go to sleep then.
No.
Here, then why don't you do it? I don't feel like doing it
I
again.
just didn't look at the little things and I'm trying to figure it out.
I'm covering the important details of it, not all the BS stuff they put in. I'm covering the stuff you're going to need to know when you're nurses someday, when you look at this thing and the person's face is like all screwed up. Now you know why, okay? So here we go. We got that. Now you're saying, okay, smarty pants, you said it's parasympathetic. What is it? Well, what's parasympathetic? Smooth cardiac glands. See glands on there being innervated? Yes. Submandibular, sublingual, and lacrimal. Lacrimal. So when your boyfriend makes you cry, that means that nerve works. Or when you make him cry, you probably me make him cry. Right? You better make him cry. Oh, okay. You have a right to cry. Why over there? Okay, so what do you think about that? So why do I have to close your eye and tape it if you got Bell's palsy? You have to put drops. Well, because there's no lacrimal vein working, the eye doesn't dry out. So if you have drops, you keep a patch over it, so the eye doesn't dry out, so the disease passes. And the person will drool and everything else, the frisbee. So when you see someone that's got like a crooked mouth, they probably have residuals of Bell's palsy. Not that they do.
The submandibular, when they're most of them kind of go.
They're underneath here.
And they get all whatever ones where they get,
No,
yeah, when they get sick,
no,
that feeling, or
that's not the glands that
take
get
a bad,
involved.
what are those, when you take a bad shot,
Those are lymph
something.
glands and stuff. Those are different glands. They usually don't get involved.
So when you take a shot or something and it goes like, what plans are those?
They're just drying it out. Okay. So what were you drinking this weekend, moonshine? When you're down in Pennsylvania, you picked up some? Oh, I believe you picked up fresh moonshine in Pennsylvania? That's what you did.
Absolutely. No, the hill for West Virginia was that's where it's best.
Yeah. Okay, so just remember Bell's palsy would go with this nerve. In case you get asked, would nerve be involved in the disease of Bell's palsy? Since it's right here, you should see it. Well, you probably see it as a nurse, you better believe it. Lyme disease exists, and Bacillus, yes. Viruses that affect this, yes. It's usually self-limiting. But usually these muscle residual on the person. They have a little pinky face. I had a student who had this, I didn't know. She had residuals of it. Because no matter where I stand in the room, when she's looking at you, she'll be whispering. So you'll be talking to her and it gets you. So finally we got to this, he goes, I have chronic Bell's palsy. I said, good. You're making me nervous, like constantly keep winking at me. It's like, oh, I'm gonna get in trouble. Let's see. Okay, vestibular cochlear. Number 8. All true from our friends. 8, okay? So, what do you think it does? Hear it? That's it?
Sounds
Just
great.
hearing? What do you think over here with them reading like there's no tomorrow? Who else been reading? She's been reading. What else is there besides hearing? Who's the city? Balance. Hearing and balance. Equilibrium. Exactly. Hearing and balance. Yay. How's it get there? Into acoustic creators, common sense, right? So what type fibers do I need for this? Sensory, motor, both. Sensory, right. 100% right. Sensory. Really, the only hard ones to learn need to be 5, 7, 9. 3, 5, 7, 9. 10's easy because everything in the world. So we look at the big, beautiful picture. So let's talk about how we hear. Well, you did 2 tests for it, one called Rhines, one called Weber's. And what are you looking for when you're doing that? Bone conduction, right? Ear conduction loss is what you're looking for. That's what the test represented. And the best one is the audiometer because it really tells. But Rhine and Weber's, I could ask you, which one would go on the vertex of the skull? Weber's. They get a Weber grill. Big grill with the thing on the dome. Ryan's is when you put on the mastoid and you put it here after. Remember? We did that in lab 2 whole weeks ago. I know it was a long time ago, people. You know, but yes. So this is pretty cool because you got sound waves coming in, which whack against this, which make mechanical energy, which go in here, which will still be mechanical energy, which turn into electrical energy and go to the brain, and you can hear. It's pretty neat. So how do you hear? Oh my ear, oh, good job, Rockefeller, you know, scientists. So what's going here? Inside this cochlea, why it's called cochlea? Because it looks like a shell, cochlea, right? That's why it gets the name, cochlea. Like, you know, the crabs hide in these. So here we are with our shell. Inside here, there's a liquid called endolymph, E-N-D-O, lymph, endolymph. And what happens when the sound comes in, it's the stapes. That stapes is a little thing like an open window, and it hits it. When it hits it, it causes a wave. And that wave moves the endolymph, goes through. And when it does, the cilia are in there, and they start to move. And when they move, they fire the nerve, and you hear. That's how it works. Got it? That's how it works. Now, what's this canal? That's known as the eustachian tube. What do you think that does? That connects down to the nasal pharynx. What do you think it does? How many times do we fly when we first go up, your ears go, and then they pop? That's that popping open. Pressure. It's to release the pressure building up in there. That's what it is. It's equalized pressure. That's why you have this, so you don't blow this out. That's why if you have an ear infection when you fly, you can blow this thing right out with the eardrum during the flight. It's going to be wonderful. Oh, you don't get blood oozing out of your ear. So that's why you're not supposed to fly if you're going to do anything like that. So here you go, here. Okay, so we see that. And so this is external, middle, and internal. So otitis media would be infection like most kids get. Okay? So here is the inner ear, so that's where you hear from. So that's the hearing side. Well, how about balance? That's the vestibular division. Right? This is coming in to here. It's like 2 nerves in one. So the one for hearing is cochlear. The one for balance is vestibular. So they're 2 separate nerves. How does that work? Well, we have these semicircular canals, and they run in each direction like a gyroscope. And same thing, there's endolymph in there, and when they move, they stimulate the nerve to go back to the brain and fire into the postural muscles or whatever to keep you from falling down. So there you go, where hearing and balance go together. And it works the same way, the cilia will move and it fires the nerve, same thing. So what happens when someone is like, so how would you test this besides spinning me with a chair? What else can I do? Well, the other test they do is called the caloric test, like calorie caloric. And they put ice cold water in your ear canal. And that's what they do. If you have a little bit of a labyrinthitis, you're going to get dizzy as hell. Because cold water will stimulate the nerve. So they do torturous things like this to you.
Now, if you have vertigo,
Yeah. So what's the drug doing? I give it to you. I give you antiver or any one of those
it's
drugs.
annoying though.
It's annoying.
Isn't it?
Well, you can get nausea, yeah, but what does the drug do I give you to stop that? What do you think? It has 2 for. 1, it slows down the nerve from reacting. 2, it dehydrates the canal. So the nerve can't react. So you don't get motion sickness.
Where are the crystals? I always hear about vertigo and having crystals, and you have to go get the crystals. What are you talking about?
That's damage to the canal. They can't go in that canal if they don't.
They do like a therapy, like if you have vertigo, and I've had people that have vertigo for extended periods of time, they send them to PT, and PT like manipulates their head and moves it side to side to the crystals. So I'm like,
There's no crystals in there.
there's no crystals.
No. It's just endolymph. What we did both. Show me what says crystals. When you manipulate C1, C2, you do help balance. physiotherapists are not trained to do that, not supposed to do that. It's against their license, it's like a chiropractor doing surgery. So being I was on the board of license, when I'd find this stuff out, I'd have the health department go down and get them the right, because they're not trained to do manipulation. When the doctor's trained, they're osteopaths and chiropractors, no one's just trained to do manipulation. They just mobilize, they do mobilization technique. It's not the same as getting in there and actually manipulating C1, C2. Yes, we can stimulate this to shut down, and I still think we get rid of the vertigo or something. But if the vertigo is due to blood supply issues, now you can stroke the patient out. So you better really look in there and see why they got vertigo. That's why I don't trust us a family doctor sending it in for vertigo. I would trust the ENT. Got it? I don't want to say what I'm talking about. I've never heard that term. In 39 years practicing, never heard that. Even when I did the ENT rotation, never heard that. Crystals. You work in a hospital. Did you ever hear crystals? Never heard that term. I don't know. It might be a type of treatment that they call that. You follow what I'm saying? You follow? Yeah. Yeah. Look it up and bring it in, the information. I'm just curious what the hell they're talking about. I never heard it. That doesn't mean it doesn't exist. I never heard it. Because we just have smarty pants who knows everything. But no, seriously, I've never heard of crystals. It shouldn't be crystallizing in there. That'd be something really bad. And manipulating wouldn't get rid of it. You'd have to go in there and somehow break up the endolymph with a chemical. So I never heard of crystal, unless it's a technique that's used to mobilize the lymph. You follow what I'm saying? They could be doing something, stimulation to it. Then I was going crazy as she is Googling stuff. But bottom line is this. So if you get asked the question, what division is responsible for hearing? It's cochlear. What division is responsible for balance? Vestibular. Okay? That's what you'd be asked about. So Meniere's disease, some people who have that, they have both. Vertigo and tinnitus. Tinnitus. Ringing in the ears. They go nuts, these people. From working around heavy machinery, they go like, damage the whole thing. Eventually, it overstimulates the nerve, and they go deaf. So now let's go into glossopharyngeal. This is the third parasympathetic nerve, glossopharyngeal, by its name. Glossop, tongue, and pharynx. That's kind of what it's innervating. What?
Yeah, how do you reset the crystals in your ear? LFE maneuver to treat EDD vertigo.
Yeah, but that's not what made this up.
No, it's not. It's really not.
There's no crystals in the ear.
Calcium crystals.
That shouldn't be in there.
Certain
And manipulation is not going to.
Calcium crystals for vertigo.
Well, that's calcium crystals. There's no such thing. That's beside the point. You
That's
crystallize
not
in
big, so
that.
that's
You
not a
crystallize in that care canal. You're never going to hear. You're never going to get balance back. That can't happen. It's endolymph. Endolymph is similar to what's like cerebral spinal fluid. It's a blood filtrate. Calcium shouldn't be in it. So I've never heard that in my life, and I know a lot of your nose and throat specialists who never mentioned that in their life. And I never heard of crystals in the ear. Usually there's a hearing problem because of nerve damage or a balance problem, not because of crystals in the canal. I don't know where these crystals would be. I never heard of that. Seriously. 39 years of practice, never heard that term in my life once. And I've had a lot of patients with Meniere's disease. And I found you manipulate them, they go worse. They didn't help them.
Detached crystals. Detached crystals in the inner ear. And can you move the crystals out of the semicircular canal? I don't know, I just knew I heard it.
Yeah, but no, I'm not denying you heard it.
Now
But there's no way I move your head and I want to detach crystals. You know what type of force that would take? I would kill you. I'd have to break your neck with that kind of force. So I don't understand now. If you put a like electrical stim or something like that, blow it into the canal, maybe that would do it. But ultrasound frequency, because that would move stuff. I can't see manipulation moving crystals that are hooked onto the cilia. That's what it'd have to
Yeah, I
be.
know it was gentle because my mom had it done.
Yeah.
They bend it back and move side to side. But now I got research it, you know.
But the other thing to watch out for most people with vertigo, elderly, it's due to a vascular insult, not just in the ear. So as soon as you extend the neck into that post position, you can induce a stroke into them through the vertebral artery. So without doing Doppler studies on the vertebral arteries and MRI studies on the brain, I would not touch that patient. I would not manipulate their neck whatsoever. I'd stay a mile away from it. Anybody with vertigo, I don't touch their necks. Like, nope, I'm not touching them. So I don't understand how mobilizing. People have had strokes in the hairdressing salon just by having the head extended back, and their only symptom is dizziness. So I don't know. I've never heard moving it this way and that way. Just moving your head itself then would move it if that was the case.
Now I'm gonna look at,
I just never heard of it. I think it's something made up to make money with physical therapy. There's a lot of stuff out there to make more money, people. Beside the point. So now back to this. Vasopharyngeal has both fibers, sensory motor and it's parasympathetic. So nothing in the end, Chris.
I'm doing a report for you, but you'll get it.
Yes, I still wouldn't.
Because I'm digging now.
I still would not do it. That's my personal opinion as a physician. I wouldn't do it. I sure as hell wouldn't trust a PT doing it to me. Okay, so let's go into here. So now, its motor function is one particular muscle called the stylopharyngeus, right here. It raises the pharynx when it contracts, pulls it up and back. Stylopharyngeus. Its sensory function is the posterior third of the tongue for taste. So 7 did the anterior 2/3, this does the posterior third. So now, it's its parasympathetic function. 2 things. One, the parotid gland, which is another salivary gland, which is big right here. Who's heard of mumps? You must have heard of mumps. You're right at the time frame when the vaccines came out, we didn't get them anymore.
Yeah, but mom's from kissing, right? No, that's the other one.
That's mono.
Yeah, that's
Because
the
we're
other
down to this.
one.
We don't want to know about your past, we're just asking
Get
about
the ones
mumps.
that kissing, I remember.
So don't kiss, so you don't get the mumps, no. Well, you would get mumps too that way, but mumps is a base, childhood disease usually, right? Mumps, MMR. It's the MMR vaccine. Right, there you go. Relish chicken pox, there you go. That's what they give you for. Well, this gland would swell up like a balloon. The person being that. So when I was a kid, there was no vaccine, so you got them all. You got the mumps, you got the chicken pox, and you got the measles, and you got the German measles when they decided to come over.
I never got the chickenpox.
Well, did you get the vaccine? You shouldn't get it because the vaccines were around, so you should not, in theory, get them. You should get the vaccine though, in case they do come around, because it's really bad in the adult versions. Yeah, shingles. So what else do I have on here for parasympathetic? What's this? Carotid sinus and body. What is that? Control blood pressure. Yeah, so glossopharyngeal is involved with the vagus. From the brainstem, the visual motor centers, there you go. Okay, let's go. Glossopharyngeal. Number 10, Vegas. What happens in Vegas stays in Vegas. Let's go to the pictures easier. The vagus, the largest cranial nerve in the body. This thing runs from your throat all the way down to the proximal third of the colon, or your large intestine. That thing goes from here to here. Turn vagus into 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120, 121, 122 So in other words, this thing does everything. It's sensory, it's more parasympathetic to the entire gut, chest and gut, and your throat. You talk because of this nerve. You swallow because of this nerve. So 9 and 10 combined make up the gag reflex. When you only raise the palate, they touch that. Because of 10, you go, you raise it because of 9 and you respond to it because of 10. So think about someone that has hoarseness when they exert themselves and want to pass out. What's happening? And this nerve's involved. Pass out makes it. Why would I get hoarse? Because the nerve that controls your talking, it's called the recurrent laryngeal, comes down and loops around the aortic arch and comes back up on this side. So what would be doing that most likely an aortic aneurysm dissecting out, pressing the nerve. And the lightheadedness is where you get subclavian steal syndrome from it, you're pushing all the blood towards the subclavian, not to the head, so you get lightheaded and hoarseness of the throat. Yes.
This nerve's also parasympathetic, right?
Yes. It's the last of the parasympathetic. So what are the parasympathetics? There's 3, 7, 9, and 10. It's a parasympathetic. Don't mix it up with 5. 5 is easy to mix up and because it's a big nerve. So this thing does everything. All the way down. Without your screw, then you get that big dystrophy. In other words, overstimulation of this, the person blanks out. So I had a student with that. I didn't know. And I was lecturing for the back of the lab, near the windows. There was a sign that was different thing. And I was dissecting the cat, and I'm talking to her, showing her something, and once she goes like this, over she goes, I caught her, because her head would have smacked the radius, still like an arrow hit. So I caught her just before she hit the ground, get to the ground with her, no pulse, no respiration, dead, 19 years old. So I start CPR, and I'm yelling in the class, call security, get a rescue here. I mean, all future nursing students, but instead of coming help, they all run this way. I'm the only one that goes with the student, and Rose goes away. All run away from it like it's a disease. So, and I'm yelling, call security, and the security's arguing, do we really need yes, we need a rescue. I'm not making a call on this kid. So she finally starts coming out, and after a couple minutes of CPR, they're rushing all over the place. And rescue shows up, they check her out, and she explains what she had. And she almost for no reason just, and she's been to Boston, New York, all around, to all the big neuro centers, and they don't understand why people are in this thing. And it's one of the years I'm sure today they have figured it out. They were like it was 40. But, you know, the rest of the semester kept her in the front of the lab. You sit over here on the low stool, so you fall down, you don't have an issue. Luckily, there was nothing else the rest of the semester. So in other words, if you one way to stop a rapid heartbeat is to stimulate the vagus. If they do.
So how often would that happen to her?
It would just happen. So what happened while she was driving? She'd kill herself or somebody else, right? Scary. But don't you be like 19 years old and this is happening to you?
That sucks.
Yeah, then you'd be like dead for a minute and then come out because the vagus nerve shuts down, the sympathetic system kicks back on. Okay. Alright, so now we're going to go to number 11, very easy nerve. Now notice we said the accessory nerve or spinal accessory really isn't a cranial nerve, and here's the reason why. Look where its roots are coming from. C1 to C5. So it's really a cervical nerve. And then what it does, it comes up through foramen magnum and then out through the jugular foramen. Because 9, 10, and 11 all come off the jugular foramen. And what else do you think comes out? I wouldn't say jugular foramen. That's why it's called jugular foramen. Makes sense, right? See, some things do make sense. You just sit back and think about them instead of stressing them. So what is an innervate? This is just a motor nerve. So it's just a motor. Very easy. What's an innervate? Last one. You see it up there for two muscles. Trapezius and sternocleidomastoids. How would you test it? Shrug your shoulders, turn your head. It's working. Okay. And last but not least, number 12, hypoglossal. Just motor. What do you think it goes to? Hypoglossal canal. Why do we name that canal? Well, hypoglossal. Innervates the tongue for motor function. Intrinsic, extrinsic muscles for motor. So in other words, stick the tongue out, wiggle it back and forth, pull it in, it's working. So you realize you have 4 nerves just for your tongue. 5, 7, 9, and 12. 5 for pain and proprioception. 7 and 9 for taste. 12 for motor. So when you can name them off your head just like that without looking, then it's over. And that's the way you're going to know them to do well on the test. So get on this today, getting these nerves in your head. That you know them like that by the end of the week. Because a good part of your test is going to be cranial nerves. Because they're very important, people. This is stuff you're going to see when you look at someone's face, especially going into nursing. You're the first one that looks at the patient. You do the triage. No, it's nothing. You come back, patient's dead. Oh no, someone was killed when I walked away. Yeah. You get what I'm saying? So nursing is very important, people. More so than you think. It's more than just running around with scrubs like a maniac. You're with the patient all the time. So the next part of nerves we're going to do will be the brachial plexus, then the lumbar plexus, and then autonomic, and we're done. Autonomic is quick to go through. I think this is a good picture too. I'm sure. Now, you realize how difficult that is to dissect, keep it all together like that. It's like laying there, like, can't talk, can't do nothing. They still can see, but it can't respond. Ouch, my nerves hurt. All right, so that's it for today. So Wednesday will be these other two nerves, brachial plexus, lumbar plexus. Monday will be autonomic and probably review, and that's it.